am one of the researchers of test anxiety level of first year Bachelor of Elementary Education in Bataan Peninsula State University, Dinalupihan Campus. On behalf of my groupmates Laisel Basilio, Jeneline Jose, and Pauline Maglaki, I am Rachel Trajano, representative to present the study. One of the common fears that students encounter in school is taking an examination. The feeling of having test anxiety before or during the exam is normal, but in some cases, the nervousness exceeds to the point that it becomes a problem for students. According to the study of Sari 2018, test anxiety is considered in a study as a special fear that might not be seen in daily life but can be experienced before or during the examination. The problem is still not acknowledged in Bataan Peninsula State University Dinalupihan Campus based on the published books or research in the school library. It is the reason that provides a research gap for the researcher. In addition, based on the press survey, the first year has the higher tendency of having test anxiety among other year levels. The researcher chose to conduct this study to fill the gap of this problem. Having information for the test anxiety level of the first year students can also be guide to improve the current or future situation of the student. It will serve as an information to have a deeper understanding for the individual who experienced this kind of situation. In addition, the result of the study can be a basis to create an intervention such as seminar and IEC materials. For statement of the problem, the present study was designed to present the test anxiety level of first year Bachelor of Elementary Education in Bataan Peninsula State University, Dinalupihan Campus. We, the researchers, sought to answer 5 questions, such as: first, how may the profile of the respondents be described according to sex, economic status, and birth order? These demographic profiles are included because the researcher wants to know on what classification will give a trigger to test anxiety. In an example, the sex are included because the researcher wanted to know if the male or female has more test anxiety. In economic status, the researcher wanted to reveal if having resources give no effect to test anxiety or having a low resources will trigger the test anxiety. Lastly, birth order. Birth order is included because just like in other profile, there are studies that gives different interpretation in their classification. This might be the eldest experience more test anxiety or any birth order. For the second question, how may the test anxiety level of first year B.Ed students be described using the Westside Test Anxiety Scale? First, concentration, worry, fear of failure, remembering, confidence, and unwell. The 6 factors that mentioned came from the standardized questionnaires based on the item of the question. The question revealed the factors that can affect the test anxiety level of the students. Next, what is the test anxiety level of first year B.Ed at Bataan Peninsula State University Dinalupihan Campus? The next level is based on standardized questionnaires such as the extremely high, high, moderately high, high normal, normal, or average, and comfortably low. Next, is there a significant difference on the test anxiety level of first year B.Ed students based on their profile? After knowing the profile of the respondents, this will check if it has a significant difference on test anxiety level. Lastly, what are the implications of the study? This question can be answered after having a basis to the results to create a better intervention. Theoretical framework. Let's proceed to the discussion of the format and the foundation of the studies. start with the relevant theory. First theory is the cognitive load theory (CLT) of John Sweller in 1988. It suggested that memory can only store a small amount of information at any one time and should avoid exceeding more information to minimize the learning. The theory can help the study by having an understanding that the student experiences anxiety because it is the cause of overwhelming the information that the learner have, and in the end, it will cause a struggle for them in learning. The scenario happens especially when the individual will have more than one subject, usually in every school. Next is the dual coding of Alan Pavio in 1971. It emphasizes the processing of information between verbal and visual presentation in the individuals. In the context of test anxiety may be lessened in particular for VEd students if students employ both verbal and visual because they are better able to comprehend and remember the materials they have studied. This can ultimately help the student perform better on exam. Complementary verbal and visual coding can promote learning effectiveness and possibly reduce some of anxiety related to exam conditions. Lastly, the trait state anxiety of Christian Spellberger in 1966 refers to the two types of anxiety experience that individual may encounter. Trait anxiety represents the stable predisposition toward experiencing anxiety across the various situations, whereas the state anxiety refers to temporary feeling of anxiety triggered by specific circumstances. In simple terms, trait anxiety is like a person's baseline level of anxiety, while state anxiety fluctuates depending on the situation. Individuals with high trait anxiety may be more prone or experiencing test anxiety because of their general predisposition toward the anxiety can make them more sensitive to stressful situations like exam. Similarly, state anxiety can spike during tests due to the pressure and expectation associated with the performing well. So, in our conceptual framework, we use the IPO or the input, process, and the output. In input, it's the goal of researcher in conducting the study. It is the 5 questions that I discussed earlier in the statement of the problem. Moreover, the process is the researcher does to accomplish the study. It starts with the determining the respondent needed using the pre-survey of Texas Tech University, followed by data gathering procedure of where the researcher float a Google form platform to gather the data using a Westside Test Anxiety Scale. After completing the information needed, the data was analyzed and interpreted using the statistical treatment of data such as frequency, percentage, mean, standard deviation, and analysis of variance. After knowing the result, an intervention such as seminar and IEC material will create based on the result. So for hypothesis, there is no significant difference in test anxiety level among first-year BEd students based on the demographic profile such as sex, economic status, and birth order. Methodology. This presents the procedure that the researcher used to identify and analyze the data gathered from the respondents. Research design. The study employed a descriptive method and its quantitative research where the researcher aims to describe and assess the test anxiety level of the students. Respondents. The respondents of these studies are chosen based on the result of the pre-survey conducted. It shows that the first year experienced test anxiety level among the other year level. This study was conducted inside the Bataan Peninsula State University Dinalupihan campus. It has 80% female and 20% male. Research instrument. The questionnaire given to the respondent is standardized questionnaire that uses a 5-point scale with 10-item question. Name, West Side Test Anxiety Scale. Data gathering. In gathering the data, the pre-survey and questionnaire were gathered from standardized questionnaire where the authors provided notes that can be used for research purposes. Moreover, the researcher also found a research advisor that checked the validity of the questionnaire and served as guide how to use the questionnaire properly. Since the researcher used the measuring tools with the notes of author with permission to use, there is no need for validation. Lastly, in administering the question, the research teacher and the dean of instruction in the campus agreed to the idea that the questionnaire be administered to the campus. The researcher would no longer submit a formal letter. Ethical consideration. The research ensured that ethical consideration while doing the study. The data gathered is protected with the Republic Act 10173, or also known as the Data Privacy Act of 2012. The law is intended to protect the security of the personal information of an individual. The researcher also ensured that all the raw data gathered will be deleted once it's interpreted. Moreover, the West Side Test Anxiety Scale is a free standardized questionnaire that leaves a note that gives a permission to copy and use the scale. In addition, all the literature and the research study are properly given citation to give a credit to the work of the author. Statistical treatment. The data collected and analyzed to test the difference using analysis of variance ANOVA. It also used the frequency and percentage to show the population of the respondents and describe the number in demographic profile. In addition, the mean and standard deviation used to present the difference of variables. The mean determines the center of distribution, while the standard deviation shows the distance of the data points from the mean. For our result and discussion, I will present, analyze, and interpret the data gathered. Let's start with the demographic profile of the respondents. Using the statistical treatment, frequency, and percentage. The table 1 is about the profile of the respondents as to sex. The study has 23 or 20% of male respondents, while 93 or 80% of the population are female respondents. According to Sanapo 2011, in the culture, females tend to have a higher level of education compared to boys because of the support that encourage girls to develop better study habits, resulting in higher education. The beliefs in the culture grew to make the number of the female dominant than the male in this generation. Table 2. Profile of the respondents as to monthly family income. The majority of the respondents, 63 or 54%, has below 9,520 monthly family income. The 9,521 pesos to 19,040 pesos has 25 or 22%. 19,041 pesos to 38,030 pesos has 13 or 11% of the respondents. 38,031 pesos to 66,640 pesos has 5 or 4%, and the 66,641 pesos and above has the total of 10 or 9%. It based on the Philippine income classes conducted by the Philippine Institute of Development Studies 2018, classified the range of the family income into a cluster. The central zone where Bataan located, it has the minimum wage range to 493 pesos to 500 pesos for non-agriculture, 454 pesos to 470 pesos for agriculture, and 475 pesos to 489 pesos for retail service sector, The minimum wage in Bataan can show why most of the students have that monthly income. The profile of respondents in terms of birth order was presented in Table 3. It shows that the youngest child dominated the population of the respondents with 45%, followed by middle child 17%, eldest child 34%, and only child 3%. According to MindSphere 2023, the birth order refers to the order of child born relative to the other siblings. It is determined as eldest child, middle child, last child, and only child. The birth order is included because the different birth order has an effect on the test anxiety of individuals. On the other hand, the Table 4 presents the answer of the respondents that relate to the variables of the standardized questionnaire: the concentration, worry, fear of failure, remembering, confidence, and unwell. It has a study that it can give effect that can trigger the test anxiety level of the students. However, all of the factors that are mentioned in the website test anxiety scale show a significant role in affecting the test anxiety of the individuals. The Table 4 presented there are no factors that are considered to be dominant in a reason that all of the factors appears as the source of test anxiety scale. Table 5. Meanwhile, let's talk about now the first year B.Ed student test anxiety level. It reveals that a substantial percentage of students experience high to extremely high test anxiety, with 25% falling into the high test anxiety category and 26% categorized as having extremely high test anxiety. Conversely, only small proportion of students, 3% and 9% respectively, exhibit comfortably low test anxiety and normal or average test anxiety. This data highlights the prevalence of significant test anxiety among these students, suggesting a potential need for interventions or support mechanisms to address these concerns and promote a more conducive learning environment. As a whole, having a higher level of test anxiety, as shown in the table, it can affect the student's performance, although in a moderate manner, it can help the students according to OLIWAC 2018. Anxiety builds up will not improve the student's performance. On the contrary, it will have a detrimental effect on academic performance. It is a reason why the test anxiety genuinely needs to be addressed, because it can lead to the poor performance of the students in the campus. Lastly, Table 6, 7, and 8 will present the significance of test anxiety based on demographic profile. Let's start with the difference on test anxiety levels of B.Ed students as to sex. Although not statistically significant, a closer look at the mean score of each group will reveal that females tends to display more anxious behavior when it comes to tests compared to males. According to CAN 2022, the female undergraduate students are higher test anxiety than the male. Some studies confirm the female has more test anxiety than males, but it does not support that a male is an exception to the nervousness feeling while taking an exam. However, it's a counterpart by Adetayo 2015. Studies were said that there are no difference in sex regarding test anxiety of males and females. In the connection, the research also shows that not significance regarding to the sex in test anxiety. Next is the test of difference of test anxiety level of Bachelor of Elementary Education as to monthly family income. The social classification of an individual also gives a reflection to the behavior. Although the economic status is different from test anxiety, it shares a common conceptual dimension according to Hill et al. 2016. The findings of the study shows a not significance in terms of socioeconomic status, where the respondents have an equal experience of test anxiety, although it says that the monthly family income affect the students? In the present study, it shows that it is not significant. The students that are aware from state inequality look for some circumstances to improve living but will result in decreasing the time for academic tasks that might lead to the lower level of achievement, according to Brownman et al. 2019. Usually, some of the college students have a part-time job to be resilient in this kind of problem. For the last table, Table 8, it is the test of difference on test anxiety levels of B.Ed students as to birth order. Based on Table 8, the mean and standard deviation do not give a big difference, which can conclude that the study of birth order is not significant to the test anxiety. Even in the study conducted in the difference of the character regarding in the birth order, the study shows every individual regardless of birth order can still experience it. For our output, the researcher create an EIC materials, which is brochure, and intervention, which is seminar to help students with high and extremely high test anxiety. To sum the result of gathered data, the study shows that the first-year B.Ed students in Bataan Peninsula State University Dinalupihan campus experienced the test anxiety. The data and the finding reveals that 30 or 26% of the students have extremely high test anxiety and 29 or 25% have a high test anxiety level. It shows that half the population of the respondents encounter test anxiety level. It is a proof that exam nervousness exists in the campus. Meanwhile, the demographic profile such as sex, economic status, and birth order shows no significance to the learner. Likewise, the standardized questionnaire factors such as remembering, worry, fear of failure, concentration, unwell, and confidence shows no significance to the student's test anxiety. Having more information about the factors that affect the test anxiety can help to unlock more and understand the students who experience the test anxiety. For our recommendation, implementing test anxiety intervention. Addressing test anxiety on campus should involve structured interventions such as seminars and workshops, especially designed to help students with high or extreme level of test anxiety. This program can provide coping strategies, relaxation techniques, and practical advices to reduce nervousness during exam. Additionally, regular follow-up sessions can ensure students continuously receive support and track their progress. School administration role. The school administration should recognize and support students with high level of test anxiety by effectively implementing tailored intervention. These include creating a supportive environment where students feel comfortable seeking help and ensuring that resources like counseling services and anxiety management workshops are readily accessible. The administration should regularly assess the effectiveness of these interventions and make necessary adjustments based on the feedbacks from students and educators. Teachers' understanding and support. Teachers play a crucial role in managing student test anxiety. It is recommended that teachers provide clear information about the test format, scope, and expectation well in advance. This transparency will help the students prepare adequately and reduce uncertainty. Additionally, incorporating various assessment methods that consider students' anxiety levels can create a more inclusive and supportive testing environment. Teachers should also be trained to recognize signs of severe test anxiety and provide appropriate support or refer students to professional help when needed. Parental support. Parents can significantly contribute to elevating their children's test anxiety by maintaining realistic expectations and providing emotional support. Understanding the pressure their children face and avoiding placing undue stress on academic performance can create a more relaxed and supportive home environment. Encouraging open communication about anxiety and offering reassurance can also help students manage their nervousness more effectively. Use of educational material. Effective intervention should include educational materials such as brochure, online resources, and evidence-informed counseling (EIC) materials. These resources can educate students on how to manage test anxiety, offering practical tips and strategies. Schools should encourage students to engage with these materials regularly, possibly integrating them into the curriculum or offering dedicated sessions focused on anxiety management. Future recommendation. Researchers could continue exploring effective methods to reduce test anxiety. Future study could focus on identifying the specific factor contributing to test anxiety and developing targeted intervention. Researchers may also investigate the long-term impact of various anxiety reduction strategies and how they can be adapted for different student population. Collaboration with the educational psychologists and the other experts can lead to the more comprehensive and effective solution for managing test anxiety. On behalf of my group mates Laisel Basilio, Jenaline Jose, Pauline Maglaki, I am Rachel Trajano. We are hoping that our study can help to acknowledge the test anxiety level of the students.